This Medical Monday is sponsored by the George Washington University Hospital.
Well, this Medical Monday, we're joined by two neurosurgeons from the George Washington University Hospital. Welcome, Dr. Saleem Abdulrauf and Dr. Carlos Sanchez. Thank you so much for being on the show with us today.
Thank you.
I'd like to chat with you a little bit about the focus you have at George Washington University Hospital. You both are brain surgeons, but you have different areas, and I'd like to touch a little bit on that. And I guess we'll start with you, Dr. Sanchez.
Sure, thanks. So my practice is brain tumors in adults that previously had pediatric neurosurgical procedures, as well as CSF disorders.
Okay, and yourself, Dr. Abdulrauf?
Yeah, so my focus is in blood vessel diseases like aneurysms and vascular malformations of the brain, as well as complex tumors that occur at the base of the brain, below the brain.
It's also technology that's working with you to help with some of these complex cases. I'd like you to touch a little bit about some of the technology that you're able to take advantage of at the George Washington University Hospital.
Absolutely. So technology makes what we do safer. And so for me, for brain tumor surgery, it's allowing me to see things that with my eyes alone I wouldn't be able to see. And so whether it's preoperative fMRI, which I'll describe, or intraoperative fluorescence or intraoperative MRI, all those things make surgery a lot safer.
Okay.
Yes, so essentially it's a combination of technology and techniques that make surgeries safer and better outcomes for the patients. Technology standpoint, we have an MRI in the operating room, which allows us to check things during surgery. We have very advanced microscopes that look deep in the brain with high resolution, so we could be very accurate in what we're doing. Techniques, we have evolved the whole concept of awake surgery in doing some of these complex operations so that we could decrease the risk to the patient for complications after surgery.
Well, I'd like you to tell me a little bit about some of the cases and some of the success stories you've had as of late.
Sure. 2 weeks ago, I had a patient who presented with seizure to the ER, had a right temporal tumor, and we used fMRI to actually see where his brain was functioning around the tumor. And then in surgery with the microscope and medication, we had the tumor actually glow. And so we could remove the tumor with what we could see with the microscope and then flip on the fluorescence and see the microscopic cells that are still fluorescing tumor behind, and then take that extra resection. And then once we were done there, we brought him into the MRI in the OR and scanned and made sure that that tumor was all gone. So finished the case, knew that the microscopic tumor was gone, the gross tumor was gone, saw him in clinic a week later, and he's off to Spain where he lives, got a hug. And
what about some of your cases, Dr. Abdulrauf?
Just want to share a couple of the stories with you. A young lady from California, her neurosurgeons called me. She was struggling from a very large tumor at the base of the skull, compressing her brainstem, having swallowing difficulties and with her gait. And so she came to us for the surgery. This was a very long surgery. It was 15 hours. She did very well. She's back home in California. Her neurosurgeons are very happy. Her mom called me last week. Her mom is very happy with how she's doing. So these are stories that make us feel really good. In the image, you see her tumor before the surgery in the red circle, and in the green is after the surgery with tumor gone. The other patient, also a young lady who had a bleed deep in the brain. We did her surgery with her awake because of the sensitive area. And we were talking about music and movies during the surgery, and she did very well. I spoke to her recently. She has little kids and she's with them. And so it's great to see that. And then the other kind of surgery we do is called brain bypass surgery. Most people know about bypass surgery to the heart, but we also have bypass surgery to the brain, where we take a blood vessel from outside and attach it to the brain to increase the blood flow to the brain. So this image of a gentleman middle age who had a major problem with vessels closing off in the brain. So what you see the arrow there is that new vessel we put in that is going to the brain to supply the brain with blood. Now his risk of having stroke is a lot less in the future.
Wow. A combination of your amazing skill and talent and technology working together for successful cases. Thank you so much for your time today.
thank you.
Thank you.